Now, in our second section, we will talk about some neonatal abnormalities that are common in the neonatal period. The abnormalities which we will discuss in this section include some breathing difficulties, bacterial and viral infections which are common in the neonates, and also some congenital anomalies again which are common in the neonatal period. So, principles of neonatal care. The principles of neonatal care is the keeping families together is the one very important principle or important requirement of the neonatal period or the neonatal care. If the families will be together, they will have automatically the care of the neonate will be better as compared to if the families which are not together or separated. So that's the one very important principle. Then the second or next principle of neonatal care is the optimized contact between mother and the baby. This is the time when the bonding between the mother and the baby, if it develops, it's very important. So more and more contact between the mother and the baby, even if the baby is in the neonatology unit or in the ICU, depending on the condition of the baby. The visits of the mother to the baby 3 to 4 times a day, or the baby to the mother if the mother is in the hospital, it's very, very important because it's the time of the bonding between the mother and the baby. Then the keep babies at right temperature, that's very important because of the temperature difference between the intrauterine period and outside can cause different complications and problems. So right temperature is important. Then breastfeeding guideline driven care is important. Proper training for the breastfeeding, proper instructions how they should be done is important. Transition and adaptation to extrauterine life, as I mentioned, the atmosphere is totally different between intrauterine and extrauterine period. So it's important that that transition period should be handled and managed properly. Then the communication, central communication is also very important. So all these are the principles of neonatal care, and mainly it's the important is keeping the families together, and then proper bonding between the mother and the baby, and maintaining the breastfeeding, importance of breastfeeding, how often it should be done, and if it's not enough, what type of different formulas can be used. All this is the time in which this can be decided. Common problems which are associated with the term babies. Term babies are the full term babies, and the term is 40 weeks gestation. Breathing issues are present if there is delayed adaptation. Then we have cardiovascular issues, delayed metabolic shifts, antenatal events like meconium aspiration. Here, this is the meconium is the fluid that can be aspirated and cause the pneumonia, and different complications can also occur with the term baby. So they have breathing issues, they have, if delayed adaptation, they can have cardiovascular issues, they have if they have delayed metabolic shift, if the different enzymes are not functioning properly, if the adaptation to the glucose level is not proper, then different complications can occur, and then aspiration of the meconium. Intercurrent illnesses like infections can also occur in the term babies. Next, the management and poor condition at birth. The management is important is stabilizing the baby depending on the Apgar score and any abnormality. If the baby is not breathing properly, if the baby didn't cry, if the tone is not good, if the heart rate is not good, all that can be handled depending on what's the problem at birth. So the main aim of the management is stabilizing the baby. Using age-specific oxygen saturation targets, again, it's important. Oxygen saturation should be maintained depending on the age at which it is given. So this oxygen saturation at using age-specific targets. Keeping baby warm and premature babies not dried, so it's important that the babies which are premature, they should be kept in the incubators, should be kept in the warm environment and they not dried. Poor conditions at birth is due to number of processes. It can be self-limiting. Sometimes the babies recover on their own, self-limiting. Assessment is important by Apgar score. And standardized procedure for life support. If the condition is poor, if it's not self-limiting, then the proper management should be performed depending on what's the Apgar score, and we should use the standardized procedure for life support like ventilation, intubation, all that can be performed depending on the condition of the baby. The Apgar score is usually is the assessment of the newborn baby depending on the respiratory rate, if the baby cries or do not cry, what's the reflexes, irritability, pulse, heart rate, skin color or of body and extremities. If it's blue and the baby is cyanosed, that's not good. Muscle tone is important. If the muscles have some tone or the baby is flaccid, all these constitute the Apgar score. If the Apgar score is low, the baby needs special care and attention, needs NICU, which is neonatal intensive care units, and they should be handled under specialized care. The breathing difficulties, first the breathing difficulties, airway obstruction. If the airways are obstruction, we should put the baby in the neutral position. And we already discussed the neutral position is the head tilted back, chin lifted, that opens the airway so the breathing is easier. If there is issue of secretions, usually the patient have bradycardia, which is the low heart rate. Surfactant deficiency, it's rare, it's not very common. Surfactant is the secretions that keeps the walls open and the breathing is easy. So surfactant secretion deficiency is rare. Transient tachypnea. Tachypnea is the fast breathing, high respiration if there is persistence of lung fluid. Meconium aspiration leads to pneumonitis or infection. So these are some abnormalities that can occur, breathing abnormalities that can be present at birth. So airway obstruction, we should keep the patient in the baby in the neutral position. Bradycardia is present if they have secretion issues. Trachepnea if there is high respiration and persistence of lung fluid. Meconium aspiration can cause pneumonitis. These are the x-rays of the newborn babies. The chest, you can see not normal here, and then the intestine, air in the intestine. Surfactant deficient lung disease common in insulin-dependent diabetic mother. So if the mother has diabetes, especially insulin-dependent, then the surfactant deficiency disease is present. Suspected bacterial infection. Suspected bacterial infection, if it's early, usually is due to limited range of bacteria. Common cause is group B streptococcus, Streptococcus agalactiae, and Staphylococcus aureus. E. coli, if present, we treat it with gentamicin, and Haemophilus influenza B, we use the cefotaxime. And then the perinatal infections are part of intestinal flora. So these are the infections. If they are early, usually limited number of bacteria involved. It commonly is due to group B streptococci, and then we have Staphylococcus aureus, Streptococcus agalactiae, and the treatment, if it's E. coli, gentamicin. If it's Haemophilus influenza type B, is cefotaxime. And in the perinatal period, infections are due to intestinal flora. Intrapartum antibiotic prophylaxis is important to prevent different infections. So antibiotics are given prophylactically to avoid infection in the neonatal period or in the perinatal period. The late bacterial infections cause neonatal meningitis, syphilis. Neonatal meningitis is the inflammation of the meninges, which are the lining of the brain and spinal cord. We have 3 meninges, and the infection of that causes meningitis, and we have syphilis, which is other infection caused by Treponema pallidum. So early infection and late infection cause meningitis and syphilis. After the bacterial infection, next common types of infection is the viral infections, which is herpes simplex. Herpes simplex is in 20% of the cases, herpes simplex infection is fatal, and it can transfer from the mother to the baby. It can be localized, it can spread to central nervous system, and can be disseminated, involve different structures or organs. 50% risk of developing systemic herpes. C-section reduce the spread of infection to the baby. Treatment is by acyclovir. Then we have varicella zoster, another common viral infection in mothers who develop chickenpox. We have varicella zoster virus. Transplacental antibodies are transferred, and they give the protection to the newborn babies. So if the mother has chickenpox, they have antibodies present in their system. Those antibodies transfer to the newborn baby through placenta and give protection to the newborn babies, but can cause complications like pneumonitis. Then we have HIV, another infection. Monotherapy with zidovudine is used if the number of HIV RNA copies are more than 50 then per ml. plasma, then we should give the combination therapy. So individual therapy is given, but if it's more than 50 per ml, then we should use the combination therapy. Then cytomegalovirus CMV cause the learning disabilities, sensory neural hearing loss, and congenital type we should treat by a intravenous cyclovir. So these are some common viral infections which can affect the newborn baby, transmitted from the mother, like herpes simplex, can be avoided by doing C-sections. Different pictures of infections, blisters of herpes, and this is a very, very severe infection and baby is affected. Feeding difficulty. Usually if the baby has feeding problem, it can cause starvation, semi-starvation, supported by mother, baby and helper. Formula milk is used. If the baby unwell, we should interrupt the breastfeeding and we should try to use the alternate means of nutrition to avoid the starvation in the baby. Protection from necrotizing enterocolitis. So this is the, if you see inflamed bowel, the redness, this is inflammation of the lining of the bowel. And then this is the picture of the baby which have feeding problems. Tongue tie is one abnormality. So this is the feeding problem. Tongue tie mainly asymptomatic, breastfeeding linked with it, surgical division. So tongue tie, the tongue, baby cannot move the tongue, and this can cause feeding problem here. It is relieved or treated by the surgical division of the separation of the tongue from the tie. So this is tongue tie. Some other complications which can occur is jaundice. We already talked, jaundice is the high level of bilirubin, very common, especially in the preterm babies. Jaundice, they are born with the yellowness of the skin and the eyes, and it's called the jaundice. Bilirubin should be measured, and anomalies of enzymes, liver enzymes, morphology, cephal, hematoma, endocrine reasons, all these should be diagnosed. Phototherapy, which is interrupted by breastfeeding. So phototherapy is important. These babies who have jaundice and high bilirubin level, they are kept in the light, so they should get benefited from that. That's called the phototherapy or the light therapy. Exchange transfusion is important. Then hypoglycemia, which is decreased level of glucose in the blood. Usually we should monitor blood glucose level if it's symptomatic. Cause brain damage, treated with IV glucose. Then seizures. Seizures can also occur due to hypoxic ischemic encephalopathy. During the delivery, during the birth, if there is hypoxia or decreased supply of oxygen to the brain, it can cause seizures. Stroke, IV hemorrhage, intraventricular hemorrhage in the ventricles, it can also cause meningitis. Electroencephalogram or cerebral function monitoring should be done. So these are all different complications that can occur in the newborn. Phenobarbital is used for the seizures and phenobarbital therapy supplements like midazolam and phenytoin. So all these can be used to treat the seizures. Now let's talk about some congenital anomalies, which can be dysmorphic features. Common, no effect if 1 to 2 features. So dysmorphic features are common at birth, but if only 1 to 2 features are present, usually it has no effect on the newborn. Wait for swelling to subside to look for any dysmorphic features. Trisomy 21, which is Down syndrome, and then also we should have a pediatric assessment to look for a cardiac defect. We should do the ECG. Cleft lip and cleft palate, assessment of feeding abilities and also adaptation to feeding is important if the newborn has cleft lip and cleft palate. Then corrective surgery is performed to treat these two conditions. Hypospadias is the opening is on the lower side of the penis. It's a problem present in the male newborns. So hypospadias abnormally place urinary meatus, chordae of penis. Then surgical correction is performed after the assessment of the baby by multidisciplinary team. So all these are different congenital abnormalities that can occur in the neonate. Can be a part of ambiguous genitalia, especially hypospadias, when the genitalia are ambiguous, baby born with both male and female genitals. Heart murmur is urgent intervention should be done if there is a heart murmur in the baby. Urgent intervention, duct dependent prostaglandin E2 is given. Duct needs to oxygenate blood. A fetal cardiology assessment is recommended due to hypoplastic left heart atresia stenosis. With cyanosis, heart failure, cardiovascular system collapse, acidosis, and leads to cardiac failure. So heart murmur, if present in the newborn, it's an emergency, should be handled on emergency basis because it can cause very bad cyanosis and acidosis and can cause cardiac failure. So this was all about the abnormalities or neonatal abnormalities. Thank you for watching sqadia.com.